surgery was about 6 months ago. Not quite.
Well, not quite.
And you had a nerve irritation after the surgery.
A little bit.
That's
yeah.
what you are going to talk about. No, it was more than a
Well,
little.
it was a
Describe it to
little
me.
bit meaning in my foot.
In the foot.
You're right, not
Yeah.
all the way up my leg or
But
anything.
at times you couldn't even touch it. Describe it to me.
Yeah, when I went to bed at night, I had to wear a sock because the tip of my toe was so sensitive I couldn't touch the covers over my, so I'd have to take the covers
Very
off,
sensitive.
put my foot out.
Yeah.
The tip of my toe now, that was it. And that went on for about a month and a half, I suppose.
But then it got better.
And the Lyrica worked. Yep, the Lyrica.
How is it now?
Now I just have a little bit of numbness on the top of my foot, and it just seems like behind the first knuckle of my big toe.
Yeah.
Otherwise, it's 90% gone.
90% gone within the 1.5 month time period.
Yep.
And that is exactly what we are usually expecting.
That's
So
what I understand.
This is
Yeah.
actually what we did, and I'm going to explain it so everybody understands that. In our surgery, I have to push this nerve to the side to get in. And sometimes when I push it to the side, this nerve is already angry.
Right.
Because that's why we are doing the surgery. The content of the disc is pushing on that. By me just pushing it to the side
To do your work.
to do my work, get even more angry. And what you very well described, and it's exactly what sometimes happens. Now, at first it can be very discouraging, and it can be like what you described. We call it neuropathic pain, but the prognosis of that is fantastic.
Oh, yeah.
In our study, only 1 in 303 patients didn't improve within a year, and I need to say that open surgery, the risk has been reported significantly higher than that. So even in that regard, our surgery is safer, but this is a risk of procedure that we do. But was it worth it?
As long as it goes away, I could hardly walk. I couldn't walk hardly at all
Before the surgery.
Before the surgery, getting out of bed in the morning, and it would take me an hour and a half, and I could walk it off. But the morning, always after bed in the morning, it was all the way down my leg. It was
So before the
hard.
surgery, you had pain as well in the same leg, in the left leg. That's why, I mean, that was under pressure. The pain that you had before the surgery in the leg, how is it now?
Well, it's gone. When
It's
I get
gone.
up, when I get up in the morning, I'm zero pain.
Yeah.
Yep.
And as well, the back pain in the morning is much better. Obviously, we are still working on the bone to grow, but this is your picture here, and it shows that this is from February. This is today. In February, still there was a gap here. That gap is minimal, meaning bone is already growing significantly. And look at that. There's a very tiny gap on the bottom of the cage.
That's almost gone.
That is gone. That is completely gone. Here is a little there, but once it makes a connection, and it has made the connection, so I'm actually very happy. So the fusion here, look at that, is making connection. Fusion just 5 months or so after the surgery is almost complete. It's still, that is a weaker bone. With time, it's going to become stronger.
Right.
So don't go for a bungee jumping or
Right.
on excessive things.
Right.
But overall, I think your back is getting ready.
Yeah, I'm back to work. I was back to work a month and 2 weeks.
Wow.
And yeah, they
That's
didn't
amazing.
yes,
Most
I had a good job. I
Yeah.
didn't have to run a computer, and I could
Yeah,
sit a
yeah,
lot. But I went back a lot earlier than they wanted. They thought I could.
Yeah.
And I was able.
And
to.
even though in your case, we didn't have our usual, best result where you don't have that nerve irritation. You even had that nerve irritation, but still, we turned around within 1.5 months. You could go back to work. Overall, so far, happy with the results?
Oh, for sure. Yeah.
Excellent. Well, thank you so much for the interview.